Hi, I'm Liz Edgell, and I'm going to talk about understanding health insurance in plain language. This is really intended to help you explain to others how health insurance works. So it's going to be pretty basic info, basic wording, because we're thinking community health workers or nurses or assisters who want to explain health insurance terms and how to use it with their clients in a pretty simple way. So our presentation today will cover, it'll offer some examples of how to talk about the broad concept of health insurance. We'll talk about a resource that's free and available online that will help people navigate the healthcare system and understand their coverage better. We'll cover some simple definitions of health insurance terms. We'll talk about some cost-sharing terms and concepts because people are always curious about the money. And we'll offer reminders for what you should know about your health coverage. So it's also really important before we even talk about selecting or purchasing or using health insurance that we kind of back up and talk about why we need health insurance. It's sort of a hard concept. Thinking about spending money on something that you may or may not need to use and learning terms that we rarely talk about. Nobody really enjoys talking about health insurance, so it's important that we kind of have our spiel ready about why we need it. So think about in your own work or in your own personal life, how do you talk to people about health insurance? How do you explain the value? Sometimes it feels political, so that makes it hard to talk about as well. Or maybe you're working with clients who can't really afford it or don't think they can. So how do you explain why health insurance is important? So basically it's about cost. Healthcare is expensive in the United States, and without health insurance we have to pay for these expenses by ourselves. So buying health insurance will protect us. So it's a little bit like an umbrella. You can think about being caught out in the rain without your umbrella, and you may not always need your umbrella, but it sure is nice to have it when you need it. So we can think about that as a metaphor for health insurance. Some other people like to think about health insurance as a common good. So basically, anyone who has health insurance pays his or her part in sort of a communal pot. And then if someone gets sick, that pot of money can be used to cover their healthcare costs. So, and then if it's your turn, if you're the one who's sick or you need surgery, then that money goes to help you. So this is sort of this broader concept of health insurance as a common good. And this is also when you think about the Affordable Care Act and that individual mandate, when the government says everyone should have health insurance or everyone must have health insurance or pay a penalty, what they're saying really is we need healthy people in that community of health insurance folks too. And then those young invincibles will of course age and need health care later also. So you pay in when you might not need it as much, but then later when you need it, it's there for you. So now we're going to talk about health insurance, the general terms, but I mentioned a resource earlier, and it's called From Coverage to Care. This is a booklet that you can order hard copies of. The website is on the slide. Their website also has a lot of resources and handouts if you want to go there and sort of explore. This was created during the Affordable Care Act when it was first issued, and it was to help people who may have never had health insurance before or who maybe didn't have it for a long time to get back in the system and understand how to use it. So just having an insurance card doesn't mean you know how to use our healthcare system. It's very complicated. Even working in the healthcare system, you may not know how to use it when you need it. So this booklet is very, very helpful. It can be ordered. You can order, I think, up to 100 of them at once for free. And they also have it in multiple languages. So when we're talking about what we need to know about health insurance, there are some basic things that we need to understand. We're going to need to understand cost. We're going to need to know some key terms. You're going to want to look at your plan and see what services are covered. And then that that all-important issue of in-network or out-of-network. That's a hard concept, but we want to make sure that we understand it so that we use our healthcare system the right way. Cost sharing basically is a broad term that talks about whatever you have to pay, you as the consumer or you as the person who has health insurance, what you have to pay. So even though you have health insurance, with most plans, you have a little additional cost also. Your insurance may cover most of the cost, but you may have your own part, and that concept is cost sharing. These terms are all health insurance terms, mostly about money and payment, so they're really important for us to understand. The premium is the payment that you usually make monthly to an insurance company to have your coverage. Some people think about this as what you pay to be a member of the club, and then your card is your card membership, but every month you pay to stay in the club. You may or may not need the services, but you've got to pay to be in the club just in case you need it. With private insurance, you may pay this every month. If you get your insurance through your employer, they may pay every month, but it's taken out of your paycheck, the part that you owe. If you purchase a health plan, you may receive a bill in the mail, and you may pay it that way, or you may pay it online automatically. And even in Kentucky, there was discussion about having Medicaid members pay a premium to have their Medicaid. And that hasn't happened yet, but just keep that on your radar in case those changes do come through. Deductible is the amount that you pay for services before your plan will start helping you. So every insurance plan is different. Every person's coverage may be different. So you need to check and find out what your deductible is. And basically that means you're going to pay for some of the services, and then eventually your health insurance, when you hit that deductible limit, your insurance would start paying for everything in some cases. The copayment is often called the copay. This is a fixed amount that you pay for a certain healthcare service or supply. So an example is if you are sick, you go to the doctor's office, you may pay a $15 copay. That means your insurance is paying most of the cost, but you are paying a small amount yourself. Even with Medicaid, there are some small copays now in Kentucky. Not for every type of Medicaid, but for some folks, you may pay $3 for an office visit, $1 for generic prescription. And I like to just tell everybody, everybody's insurance is different. So you've got to learn what your copay is. You've got to be prepared to have it with you. And also know, for Medicaid especially, there are some circumstances where if you cannot afford it, if you cannot pay it, you cannot be denied the service. So make sure you know your rights. There's another type of insurance called coinsurance, a coinsurance plan. And this means after the deductible, once you've reached a certain amount of money, your insurance would pay for part of the coverage. So, for example, if your coinsurance is 20% and you have an appointment or a procedure that costs $100, you know you would pay $20 because that's 20%. So it's not a fixed rate like a copay, but it is an amount of money that you pay along with your insurance. So this slide, the next couple of slides offer a visual. So you may be working with family members or with community members or clients who are visual learners, and I think that these are nice illustrations of how to explain health insurance. So let's pretend that you have a bill. You have your money. Those are the light colored beans. And if you don't have insurance, you pay the entire cost. So the whole jar is filled with your money in this example. In the next example, you might have health insurance. So the black beans, the dark beans, are representative of your insurance and the money they pay. The light colored is your money. So in this example, the total cost for a surgery or something is $2,000. And your deductible is $500. So remember, that's the amount that you have to pay before your insurance plan starts to help. And then the remaining amount is $1,500. So this is what it would look like with the bean representation. The light colored, your money, is down at the bottom. That's the $500. The rest is insurance money. So it's a nice example of, even though you're paying for insurance and that might feel expensive, you can see that your insurance really helped you. You did not have to pay $1,500. In this example, it shows what a coinsurance model would look like. So you might pay that deductible, the light colored beans at the bottom, and then your insurance picks up a person, a large chunk, and then you pay that little stripe. That part is your coinsurance, and so on and so forth. So that's a nice visual representation of what coinsurance looks like. These are some common cost questions, and I'm sorry there's so much about cost, but that's really what health insurance is. It's a way to cover and help you pay for services. So a common question that we might hear: I pay my premium every month, so why do I still have to pay money when I go to the doctor's office? The answer is that even though you pay premiums, you still may have to pay a copay or copayment for most services and most prescriptions. So that amount that they're asking for at the doctor's office is your copay. In this other example, we can kind of flip the question a little. I paid money when I saw the doctor, so why did I get a bill in the mail afterwards? The answer is that little amount that you paid at the doctor's office was your copay. That was that fixed amount that you have to pay, $15, $20, whatever your copay may be. And then the bill is the remainder of the cost. Probably in this scenario, you haven't met your deductible yet. And it's very easy to forget that. I've done that mistake myself where I got a charge and I said, why did I get this charge? I have health insurance. And I called my plan, and sure enough, they reminded me I had not met my deductible yet. So it's very common to forget that, and it's just the way that it works. You have to meet that deductible first. Another common question might come up. I met my deductible, but I just got a bill for 20% of my last medical procedure. Why did this happen? Probably in this case you have coinsurance. So 20% was the coinsurance. That's the smaller amount of money that you have to pay for your medical care after you meet your deductible, but before you meet your out-of-pocket maximum. And we didn't talk about out-of-pocket maximum. That's another health insurance term. It is covered in that Coverage to Care booklet that you can find online. But the out-of-pocket maximum is also different for every plan, and that is the total amount of money that you would pay in a year for your health cost, and then your insurance would have to pick up after that. So it's a protection for you. It is important to sort of review and know what your health coverage will cover for you. And many people don't realize if they have employer-based coverage or if they buy insurance through the federal marketplace, through the Affordable Care Act, there are promises about what will be covered. It really made changes to what was guaranteed and what was a minimum for health insurance companies to provide. So you can go to this website, What Marketplace Plans Cover, and learn about these 10 essential health benefits. Maternity care must be covered if you buy a health insurance plan on healthcare.gov. Rehabilitative services, pediatric services, mental and behavioral health are treated with parity with physical health. That means that they are covered also. Your preventive and wellness services like mammograms that are age appropriate for a woman, colonoscopy that are age appropriate. Your hospitalization must be covered, your lab services, prescription drugs, ambulatory patient services, and emergency services. So these are the 10 essential benefits that are covered under plans after the Affordable Care Act, especially on that federal marketplace. And it's really important to know that sometimes you may not have a copay if it's one of these services, and the wellness visits, for example, for your children, or your mammograms if it's age appropriate, some of those things will have no copay. So it's important to ask and learn what may be available for you at no cost. And there's also documents that help us know what each insurance plan will cover or what your own insurance would cover. So it's called a summary of benefits and coverage form. There's actually a website written on the slide that you can go to kind of learn more about a summary of benefits and what it would offer. There's an example on there of like an Anthem summary of benefits, and then the other graphic explains that kind of peeks in at what it would cost under a certain plan. So you can use something like this when you're choosing which health plan to buy. You need physical therapy. You might want to see how many sessions are covered, for example, or what the co-insurance costs would be, how much is covered by your insurance. You also have the right to ask for this at any time from your health plan. If you're thinking about a treatment or an option and you want to know how much your insurance would pay, you have the right to ask them for this document. They also have to provide it to you at certain times, like if it's an open enrollment period, if it's time to sign up for coverage, or if it's a new year of service, they need to provide it to you. We mentioned a little bit about network earlier. This comes up all of the time. It's an important concept that with certain insurance plans, they have preferred networks. That means they have made relationships with certain healthcare facilities, certain hospitals, or certain providers. This can be with outpatient labs also, x-ray services, all kinds of things we don't always pay attention to, but we should, because these folks actually have contracts with your health insurance plan, and that means they provide a little discounted rate and cost. So they work in partnership. And for you, as the healthcare consumer, when you are using our healthcare system, it's usually more expensive if you go to an out-of-network provider. So it's important to find out and to ask. Usually you can find this information by calling the number on the back of your insurance card. You can go to your insurance plan's website and search there for providers that are in network. And sometimes you can ask a provider before you have a service. So this is a slide that kind of goes into more detail about finding those in-network providers. It is cheaper usually to go in-network, so you do want to ask. It's worthwhile to ask, and you want to ask before you go and have the service or before you go and have the procedure. Like I said, you can look online for it. Sometimes that's the best because these networks do change. So if you have Anthem insurance, for example, you go to your website and you log in. Usually you can enter your zip code and you can find an ear doctor who works in your zip code who's in network. Or if you need a cardiologist, you can find which cardiologist is in network. And another way is when you call to make an appointment, you want to ask, I have this insurance, do you accept it? And they usually know, the providers know, if they work with it, if they accept it. And again, these can change. So even if you schedule something several months out, you might want to double check right before the procedure and make sure they're still in network. And this is one of my last slides, but it's a video, it's a screenshot of a video. If you are working with visual learners, if you are, or if you want to prepare yourself and make sure you really understand these terms and definitions that we went over quickly today in plain language, I really recommend this video. It's done by Consumer Reports. It's free and available online, and it helps demonstrate how much money you would pay in a copay, how you have to pay and meet your deductible before the other things are covered. They literally show buckets, and I've worked with people who said, oh, I love it, I can understand now what bucket the money's going into. And so it's a good resource if you want to check that out before you start working with people and trying to explain these more complicated terms. And these are resources that are available for you. The first one is that Coverage to Care book that I said is free and available. You can order online or you can print certain pages of it if you want to. There's information, the other bullet points there are about your summary of benefits documents and what the essential health benefits are. And the last link there is that Consumer Reports video again. And my contact information is there. I'm always glad to field questions. I came about this work by explaining our healthcare system to newly arrived refugees, so we've had to learn to explain it in pretty simple terms, but I find that it's really important information for all of us to have. And like I said, no one likes talking about health insurance, but it's important that we know it, and it's important that we have resources to turn to, so I'm glad to help.